Good afternoon, Madam Chair, members of the board. Thank you so much for agreeing to one additional meeting. Probably will not be our last meeting regarding this topic, as I believe, considering the nature and evolving nature of this crisis, of this virus, ongoing communication with the board, directly and indirectly with the community, will be a must. Madam Chair, members of the board, it is indeed a pleasure to provide you with a broader perspective to you and the broader community, with a perspective of an important update on the district's overall reopening strategy. As you know, I last came before you with our tentative plan back on July 1st, and as we have discussed and agreed, much has changed. Since then, we have made significant progress in finalizing our plans to welcome students and employees back, while also monitoring the status of COVID-19 in our community. Our goal is not an easy task. Our goal is to reopen smart and return safe to our schoolhouses. Before you are the principles that have guided our ongoing work at planning for a safe and smart reopening. The first four are not new to you. You've seen them before, and the broader community is aware of them. These were prominently featured in the tentative plan that was shared on July 1st. You will notice that there is now a fifth guiding principle regarding communication as we approach the first day of schooling. With less than a month before we welcome teachers back to begin their final preparations for the school year, and given the ever-evolving nature of COVID-19 within the local community, we understand the importance of ensuring all our district stakeholders are empowered with the most accurate and timely information. Since our last discussion regarding the district's reopening plan, staff has continued monitoring national, state, and local guidance related to COVID-19. Between then and now, we met with Miami-Dade County and have convened an ad hoc task force comprised of medical and public health experts to glean additional insights on the state of COVID-19 within our community. Norm on gating criteria that will further inform our reopening strategy, and obviously collaborate on contact tracing efforts. So just last week, the Centers for Disease Control and Prevention released updated guidance related to planning for a safe return in the fall, to schools in the fall. Much of that guidance was consistent with information that had been previously released, particularly as it related to the local context informing any reopening decisions. The CDC has this time also provided additional insights regarding the relationship between the reopening of schools and viral transmission risk, while emphasizing the benefits to children associated with a return to school, recognizing the deleterious effects of social isolation during school closure. The CDC also has emphasized that it is important to consider community transmission risk as schools reopen, and computer simulations from Europe suggest that school reopenings may further increase transmission risk in communities where the transmission is already high. Further, information released from the Harvard Global Health Institute indicates that school reopening policy should be differentiated by COVID-19 case incident levels in counties and districts. Simply said, a one-size-fits-all model does not work. And this has been acknowledged at all levels, at the federal, state, and local levels. They explicitly mentioned that states, of which Florida is a part, that currently have a high case incidence in many counties and districts, that those counties or districts should plan to begin the fall semester with online learning. In fact, last week, Governor DeSantis publicly stated that districts that need additional weeks because of local conditions should have it, recognizing the differences not only across the country, but even within our own state. In light of the guidance released by the CDC and their recommendations regarding case incidents in school reopening decisions, let's take a look at the last 4 months of case incidents in our community. I think part of this evolution is to a certain extent helpful and stunning. Before you are some milestones coupled with the number of new cases and the total number of cases in the county. On March 13th, when we announced school closures, it seems like years ago already, there was 1 new case in Miami-Dade County and 2 total cases. You fast forward to nearly 2 weeks later, on March 26th, when the Safer at Home order is issued for Miami-Dade County, and there were then 166 cases, new cases, and a total of 920. On May 4th, the statewide stay-at-home order was lifted for all counties except Miami-Dade, Broward, and Palm Beach. At that time, Miami-Dade had 155 new COVID-19 cases, bringing the total number in our county to 13,244. Miami-Dade County reported 257 new COVID-19 cases on June 11th, the day the Florida Department of Education released the guidance for all school districts regarding reopening of schools. With these cases, Miami-Dade's total caseload reached 20,872. Then on July 1st, we presented to you a tentative reopening plan that had been informed by the experts of the Miami-Dade County Public Schools Reopening Work Group and comprehensive reviews of national, state, as well as local guidance. On that day, Miami-Dade County had reached 2,306 new cases, bringing the grand total to over 40,000 cases. And less than a week ago, on July 23rd, when the CDC released updated guidelines for a safe return to school, 3,346 new COVID-19 cases were reported in our county, bringing the overall total to date to over 98,400, stunningly more than double the total case count from roughly 3 weeks earlier. Now, there are several key indicators that jurisdictions across the country are using to inform the reopening of their communities. Most importantly, how the viral load, or the number of people infected, is trending. Hospital capacity, particularly in intensive care units, and the percent of positive cases over a 14-day span, often referred to as the positivity. Before you are several of the most recent of these indicators for our local community, for Miami-Dade County. Despite the recent surge in virus transmission our community has experienced, MDCPS has continued to plan for its reopening. And we are ready. We as a school system are ready. We are ready to reopen smart and return safe. However, conditions in our community, based on these and other indicators, are not yet ready. We as a school system at MDCPS have been using and continue to use 8 specific metrics or gating criteria to make decisions regarding a return to the schoolhouse. Now, these are recommended by our medical experts. And as we've been told, we may not necessarily wait for all 8 criteria to be met simultaneously. There is possibly a point based on their advice when a critical number of those criteria are met and there's a downward trend that in fact conditions may have been created to a safe return to school. These, as I said, were developed in consultation with Miami-Dade County and were informed by the input provided by the ad hoc public health and medical expert task force, many of whom are joining us today, maybe a little bit later on. Some of these criteria are reported in the county's COVID-19 dashboard and have been transmitted to the board daily over the past several weeks. I hope you find them helpful. The criteria include a sustained positivity rate of less than 10%, even though many entities emphasize a positivity rate of less than 5%. That's a World Health Organization, obviously with a goal toward a lower positivity rate of 5%, but a sustained positivity rate less than 10%. Secondly, a steady reduction in the number of hospitalizations for COVID-19 or influenza-like symptoms for a 2-week period of time. A sustained reduction in ICU bed occupancy for the same amount of time. A continuous reduced community viral burden, that's a total number of virus-positive individuals during that same time period. An increase, and this is critically important, an increase in COVID-19 specific viral test availability and decreased wait time to receive a test. And this has been a priority of this board. In fact, I believe there is an item this month advocating for special testing sites for our workforce. Equally important to the availability of these tests is a decreased response time for obtaining the test results to less than 48 hours wait time. Critically important, otherwise, there is a compromising of the quality of contact tracing that requires prompt information based on test results. And last but not least, an increased number of general vaccinations for school-age children that meets the goals of herd immunity in our community. Simply said, amidst a COVID-19 pandemic crisis, we should not be dealing also with a measles outbreak impacting young children. So the gating criteria has been used and will be used to inform transitions between instructional models throughout 3 stages that we envision. And these stages are separate and apart from other models that you've seen, relying strictly on phases, as those have somewhat been modified either at the federal, state, or local levels. So the gating criteria, as I said, has been and will be used to inform the necessary transitions between instructional models during the 3 stages that we envision. Let's begin. In stage 1, which is where we currently are, commences in August, will continue, will include the activation of My School Online for all students. Throughout this stage, we will continue to review opportunities to, in a very controlled and cautious manner, begin providing face-to-face opportunities for students who may have significant learning needs. I think I don't need to tell the board and the greater community that there are some groups of students who, for a host of reasons, perhaps severe disabilities, a remote learning experience becomes a very difficult proposition to address all of their needs. So we want, during this phase, as the vast majority of our students are on My School Online, to begin the exploration of bringing some of those students in for face-to-face opportunities in a very cautious, controlled, and careful manner, addressing both the needs of the students and also the extraordinary needs of the employees with the appropriate PPE. We will explore the potential for a staggered reopening for students who may have widening gaps, learning gaps, due to the extensive time they have been away from school. This will allow us to transition subgroups of students to the schoolhouse based on need and academic fragility. In stage 2, we will activate both My School Online and the 5-day schoolhouse models concurrently. Students will be able to participate in the instructional model that was selected by their families earlier this month. Now, a critical announcement. You may notice that the hybrid model or models that we had previously discussed are absent from this stage. They are because we have abandoned the hybrid models for several reasons. First, they were never hugely popular with parents. Secondly, we recognize after further research that they provided inadequate support for working families. Equally important, the models themselves provided a slower cadence of instruction that would, quite frankly, put students in that model woefully behind in terms of instruction and content covered compared to what other students would be receiving through My School Online and or their 5-day face-to-face model. Lastly, through school plan walkthroughs and the re-engineering of school spaces, we believe we can, through broad risk mitigation strategies, keep the reduced population of students safe while learning in the schoolhouse each day of the week, enabling working families to fully return to the workforce. Now, this is stage 2. In stage 3, all students return to the schoolhouse and My School Online becomes a choice option for those families who prefer to have their children remain in that model for the remainder of the school year. And no doubt families will. Be reminded that based on the information we provided to you, about 51% of parents currently are preferring a My School Online approach, with 49% opting for a physical schooling experience as long as local health conditions so allow it. Now, we are ever cognizant that many families have already begun planning for a return to schooling through their preferred model for stage 2. However, in light of the viral surge in our community, we believe it is in the best interest of our students and employees to delay the return to the schoolhouse and commence the 2021 school year from a distance. In order to reopen SMART, we will begin laying the groundwork for a successful 2020-2021 school year beginning the week of August 24th. That week, we will engage families, students, and teachers in a week of learning and orientation. We will share more about what those activities will include later in our presentation. All students will be officially returning to schooling on August 31st. This is in essence a 1-week delay from the first day of school originally approved earlier on in the year. That day, empowered by a new robust distance learning platform, students will thrive from day one. This delay in the return to the schoolhouse will not only ensure that our students return safe, but also that they, their families, and their teachers begin the school year with a high level of proficiency in the use of our new distance learning platform in the event that local conditions call for a shift and a possible return to stage 1. Through the month of September, the district will continue to monitor the state of COVID-19 within the community in aggressive conversations with the local health department to determine whether we are able to pivot to stage 2 that would allow for the simultaneous delivery of our 2 instructional models, Schoolhouse and My School Online. We are hoping that conditions improve considerably in the next several weeks so that we can transition to stage 2 on October 5th. A decision on whether MDCPS will activate Schoolhouse model on October 5th is planned to be announced no later than September 30th. Now, I want to be clear about one thing again. All of our models are viable and ready. We are simply delaying for a number of weeks the implementation of the schoolhouse model while we are exploring bringing back students whose learning needs are at a level that they're best served in a controlled, safe environment at school. And those are ongoing conversations between staff and the employee groups that represent those individuals. Now, on July 1st, we also discussed a series of additional actions we were going to take to ensure a successful opening. These included finalizing instructional models, staff training, assessing parental preferences regarding instructional models, continuing to engage in conversations with union leaders, ensuring our supply chain for critical sanitation and safety supplies, updating our protocols based on changing conditions, and supporting schools in their implementation of this larger plan. Throughout this presentation, Madam Chair, members of the board, you'll be provided with an update on our level of readiness to reopen SMART and return safe. Today's update on the district's reopening plan includes several elements, very similar to those that were presented last time, with significant enhancements and additional information. We will first discuss the overall student experience to highlight what students can expect in the 2020-2021 school year. We will then transition to discuss how we have prepared our school campuses to welcome students back. After that, we will discuss our progress in ensuring our workforce is ready to welcome students back in a safe way next month. Parents and families continue to be our partners in their children's education. We will speak about our efforts to ensure families have been empowered with the necessary resources to best support their children's learning, as well as overall communication strategies to ensure that our entire community, our stakeholders, remain informed about our efforts to reopen smart and return safe.